You guys ever wonder how to do a proper medical school interview on Zoom? Well, here you go. Hey everyone, it's Kartik from TDJ, and today here we have a Zoom interview for you guys with Dr. Ramsamooj of California North State University. Now, in this interview, he'll be going over some questions, I'll be answering them, and it'll be like a live full-on Zoom interview. And hopefully this will be helpful to you guys as you'll get to see what mistakes I make, what not to do, and what to do. And you'll see within the video, there's also some camera tilting and stuff. Sorry about that. Sometimes I don't have the right angle for interviews, but Dr. Ronson corrected me and he's telling you guys what you guys should do. So I think that's great. Sorry guys for the video quality. Sometimes Zoom doesn't record as well and just had to go with that. Okay. Hello everyone. I wanted to thank Dr. Ramsamooj from California North State University College of Medicine for helping us today and doing a mock interview with me today. Thank you, Dr. Ramsamooj.
Oh, you're more than welcome. I'm hoping that some of this helps. Just so you guys have a little bit of background on me, I am trained as a surgical and transplant pathologist, and I spent 18 years at UC Davis practicing as well as residency program director. And in my time, I've probably done well over 1,000 interviews, med student, resident, fellow, faculty, all different levels. And I've seen a lot of, do's and don'ts, and hopefully we'll see how Kartik does, and see how much critique we'll need to do.
Sure, sounds good.
Okay, I'm ready.
Okay, I am ready too.
Okay, so Kartik, it's a pleasure to meet you. We're going to do an MMI today, and have they gone over the kind of the rules, so to speak, with regard to the MMI?
Sure, yes. I believe you're going to present me with an MMI. I have 2 minutes to prepare, and then I'll have around 5 minutes to talk about it.
Right. Okay. Excuse me. Are you ready for the MMI?
Yes.
Okay. You are a physician taking care of a patient with gastric cancer. You realize that your patient has occasionally been missing their chemotherapy and radiation appointments. You talk to the patient during your next appointment and realize that they've been seeing an alternative medicine practitioner who has recommended they stop their treatment. How would you respond?
Okay.
Do you have it? Do you need me to repeat it?
Could you repeat it one more time?
Sure. You are a physician taking care of a patient with gastric cancer. You realize that your patient has occasionally been missing their chemotherapy and radiation appointments. You talk to the patient regarding your next appointment and realize that they have been seeing an alternative medicine practitioner who has recommended that they stop their treatment. How would you respond?
Okay.
And just let me know when you're ready.
Sure. All right, I think I'm ready.
Okay, go ahead.
All right, so thank you for this MMI opportunity. And in this MMI, I am given a scenario where I am a physician and treating a patient with gastric cancer. And this patient comes in on a routine or supposed to be a routine basis for chemo and radiation, but he or she is missing these appointments, and it takes me a while to find out that he or she is going to an alternative medical practitioner for alternative medical treatments. Now, I am asked in this MMI scenario on how I would respond. Now, going forward as a physician, it is our job to provide the patient with patient autonomy and provide them with beneficence. Now, these two words mean that the patient has a right of choice to whatever they want to do with their bodies. And beneficence from a physician standpoint is that we are trying to bring the best we can for the patient, the greater good for them. Now, in this scenario, this patient is missing my appointments that I have scheduled for them, the chemo and radiation. Now, in order to deal with this, I would first like to contact the patient, have either an MA or myself contact and ask the patient why he or she is wanting to skip out on these appointments and go forward with our alternative medicine practitioner. Now, again, this is the patient's choice. I would just like to know what they're thinking, and I would like to inform them of my personal professional opinion that I think that chemotherapy and radiation is the best way to improve gastric cancer. And as a physician trained in an MD degree, I would have not been sufficient and knowledgeable in the alternative medicine practice, the way they practice. And I would be honest with that to the patient, and I would tell him or her, I am not sure about this, the way that alternative medicine works. Now, I cannot guide you in that way, but with the knowledge that I do have, I would say that chemotherapy and radiation has been proven to work. I have studied this, it is my specialty, and I would just want to provide the best good for you, which is beneficence. And that's what I would want to do for the patient. But at the end of the day, regardless of how much I explain and the knowledge I give to the patient, it is their choice to decide what they want to do to their own body. And if he or she decides they want to quit coming to chemo and radiation and go to alternative medicine, that's totally fine. That is their choice. But let's say this patient wants to do both, because according to the MMI, as far as I understood, he or she is missing a few appointments here and there. Now, if he or she wants to do both the alternative medicine and chemo, I would have to not only look into it, but also talk to the alternative medicine practitioner, maybe get an insight on what medicines they're using, if there's any bad side effects, if it works well, contraindications, and go from there, because I am not knowledgeable in this alternative medicine realm. And that's something I would work with this alternative medicine practitioner to provide the best good for this patient. Now, again, this is depending on the choice of the patient. If the patient changes his or her mind and says, I'll quit the alternative medicine, come back to chemo and radiation, I would be willing to help them with the best knowledge that I have. And that's how I would treat this scenario. I would just go about giving my expertise to the patient and letting him or her decide what they would want to do and how they want to continue treatment of their gastric cancer. And that's what I would end up doing.
Okay, thank you. Before we move on, I just want to make sure your answer, you've covered all of the things you would like to say. I'm not in any way prodding you that your answer is incomplete. I just want to make sure you've expressed your thoughts and if there's anything else you wanted to add.
No, I think I covered everything that I had notes for, that I thought of during the first minute and a half right before.
Okay.
Yeah.
All right. Okay. So Kartik, you want me to critique now, or
Sure.
and then go on to kind of okay, sure. Okay, so Kartik did an excellent job of responding. He hit on a couple of key things with this particular MMI, which are the patient autonomy, doctor to do no harm, and that ultimately it's their choice. So I think it was good that he set that kind of guideline out at the beginning. Now, when you guys are presented with MMIs, really they unless you're going to say something outlandish with the response, what most people are looking for is an assessment of what the issue is. And when I mean assessment, that means talking to the patient, getting as much information as you can, trying to surmise if there's any other factors, any other influences in the situation. And then after you've done assessing, you've got to decide what the ultimate assessment is that you've made, and then decide how it is you're going to act, taking into account all of the information that you gathered.
Okay.
Now, I'm going to talk about something that might seem a little bit off topic, but it might help some of you in the process of kind of answering these questions. I ride a motorcycle, and granted, I understand that that has nothing to do with what we're talking about today. However, when I bought my motorcycle, she's a long time ago, I took a motorcycle safety course. And the one thing that I took away from it was a mnemonic that they gave, which was SIPDE, SIPDE. And that breaks down to scan, so scan the road of what's going on, identify what the threats are, or decide what you're going to do about it, predict any threats, and then E is execute. And I think that although it applies to motorcycle riding, I think it is equally applicable in a situation like MMI, where you're going to scan or assess, identify what the issues are. P, predict what the possible outcomes are, decide what you're going to do about it, and then execute. So hopefully that little mnemonic might help a little bit. Now, while I was taking notes while Kartik was talking, and I don't have a lot of additional things to add other than maybe part of the assessment of what's going on with the patient is maybe digging deeper into why. A lot of patients, will hear something, I can't tell you the number of times my mom asked me about some ailment she may or may not have because some idiot friend of hers at her gym told her that, oh, well, my uncle had this and he ended up dying, so it could be as simple as that. Some relative, friend, trusted, whatever said, allopathic doctors don't know what they're talking about. Go to my alternative. He cured my XYZ. Also, radiation and chemo might be expensive. There may be limited health insurance for the patient. So we could go through a whole bunch of different things that could apply. But I do feel that exploring all of the possible reasons why the patient doesn't want to do the chemotherapy or radiation. I think it's good that he was honest and said he doesn't know much about alternative medicine. I think that's a good thing. Sometimes the expectation of physicians is that we know everything, and that just simply cannot be the case. Hence the number of specialties that are out there. However, I do think it is in the patient's interest to find out, and perhaps there could be a combination between the alternative medicine and the chemo and the radiation that the patient might feel is palatable, and that they would be okay with. And those would really be the only comments that I have with regard to Kartik's response.
Okay, thank you.
All right.
Do you want to move on to the generic question?
Sure.
Okay.
All right. So we've completed the MMI. And so that I can get to know you a little bit better, tell me a little bit about your background and education.
Sure. Yes, so I grew up mostly in California, in Stockton, California, specifically since I was 8 years old, and that's been where my whole childhood and adolescent life has been. I grew up there in an area where it was semi-rural, urban. It was kind of a mix. But I always grew up with knowing that there's not a lot of specialized physicians within that area. And I shadowed multiple physicians within the area. And I just got the sense that a lot of our population within Stockton had to go to big universities for specialized problems, either to UC Davis or UCSF, because they couldn't get the care that they needed within Stockton. So that was always in the back of my mind when I was growing up in Stockton. And then as I grew up, went through high school and went through these shadowing opportunities and other programs where I got to see what healthcare physicians do, I went to California North State University's undergraduate program in Rancho Cordova. And that's where I completed my bachelor's of science at. And I got more intertwined in how healthcare practitioners work. And that's something I really wanted to get into because that's the path and career that I chose. Now, besides the health and medicine stuff, I've always been passionate about Bhangra, which is a North Indian folk dance. And I've been performing those performances for multitude of years now, almost 10 years now, because I started when I was 10 years old performing. And about every year, we used to practice for performance and then perform them at our annual Diwali show in Stockton. And that was something I always looked forward to, and it was always fun. And I carried that tradition on to California North State undergrads program, where I got to get a team. We got together and we performed during the 2 talent shows that we had before the COVID pandemic happened. Now, besides Bhangra in school and medicine, I've also been really into exercising and working out. And that's something that I find is a way for me to relax and get a mental breather for me to get back and relax back into the study mode. So that's a little bit about me.
Okay. All right, let's dissect this a little bit.
Sure. Okay.
Okay, one of the things that I've noticed, and I don't necessarily mean this with regard to Kartik's response, is a lot of times when people are interviewing, they feel the need to impress the interviewer with things they've done and their accomplishments and things. And really, that is not what the purpose of the interview is. The purpose of the interview is so that the interviewer can get to know you on a personal level. And I think that's where a lot of interviewees kind of miss the mark. They want to know about you as a person, what makes you tick, what makes you you, what's unique about you. And the only way to do that is to talk about it from a personal standpoint, meaning how does something make you feel? What did you learn from something? Why are you interested in doing something? And I like to use an example. I've already told you that I ride a motorcycle, but I also love cars. I'm a big, huge gearhead. And I kind of, the example I use is something that most people can relate to, because I think sometimes making the connection between a professional or medical student interview and real life sometimes is hard without a kind of lay person's example. So the example I use is if you were to walk up to somebody kind of randomly and just ask them if they like Ferraris. Hopefully most people know what a Ferrari is. It's a exotic, high performance Italian sports car. Most people would say something like, oh yeah, I like Ferraris. They're pretty, they're beautiful, they're fast, they're really expensive, and I think it'd be, great to own one someday. That's kind of a standard answer, right? Why do you want to be a doctor? Oh, I want to help people. I like the physiology, the connection, educate, they kind of list off things, right? But if you were to ask me if I like Ferraris, I'd say, yeah, I like Ferraris. In fact, I like any kind of high performance sports car. They're works of art to me. I respect the engineering and attention to detail that go into them. But the thing that I really love about high performance sports cars, including Ferraris, is the sense of excitement and thrill that it instills in me. Sometimes just looking at a car and thinking about driving it, doing really stupid things on the road, it excites me. It gets my pulse going. It's something I'm very passionate about. I have several high performance cars in my garage, and sometimes if I have to go in my garage and I open the door, I'll look at one and, I get a little bit excited, honestly. I get a little bit excited thinking about the next time I drive it. And on my way to work, I've got about a 3 to 4 mile stretch of open highways usually, and it's not uncommon that I'll hit 130 or 140 miles an hour on the way to work if I've got open road. And it's that excitement that I really love about cars. So I hope you kind of see the difference where the regular person is kind of just telling you things that they like, but I put it in context of why I like cars, why the engineering, why the attention to detail. What does that mean to me? It does something for me. It excites me, right? So back to Kartik's response about kind of tell me why. He gave a good overview, but I would have suggested maybe organizing it in a slightly different way.
Okay.
Now, I know I've been droning on for minutes on end, and many of you probably stopped listening a while ago, which is perfectly fine. I'm accustomed to that when I'm lecturing at the university and watching the students do this sometimes. But honestly, people's attention span is usually 30 seconds to a minute. So you have kind of a short window to grab their attention. Anything beyond that becomes a little bit too much information, and they'll kind of tune out much of it. So the first thing, a critique I would make about Kartik is there's probably a little bit too much information that he put in kind of that opening thing, okay? Now, how would I have organized it differently? The way that I suggest organizing responses, and obviously I can't possibly talk about every single question you might be asked, but I think a good way to approach answering the questions is listing off kind of maybe 2 to 4-ish facts or data, like I did with the car, the attention to detail, the engineering, etc. Follow up with kind of examples of one or two of those things, okay? So in my rant about the cars, I talked about the performance and how that makes me feel. And then the third part of the response would be coming at it from the personal perspective. What do you get out of it? What did you learn from the experience? What does it say about you as a person? How did it shape you? Those kinds of things. So with Kartik's response, he talked about Stockton and the need for, I'm sorry, I'm not making good eye contact, so I'm looking at my notes, the need for more MDs and specialties in his area that's kind of rural, suburban, and patients having to travel. And then he went to CNU, and then he talked about his outside interests. But in several of those, he kind of explained each one, right? So imagine you're listening to somebody and they said, oh, well, I really like the engineering of the cars. And then they explain in detail all the engineering stuff. So, oh, I also like the design. And then they go on with that. It is a little bit hard for the listener, the interviewer to follow. So my recommendation is to list off a couple of things, 2 to 4-ish. Pick one of those that you feel really exemplifies you as a person. Talk about it a little bit, and then close with the personal standpoint. Because again, that's the way you're going to make the connection with the person that's interviewing. Okay. You're not going to connect with them because you feel the same way about cars. You're going to connect with them because, you don't like the same things about cars. You're going to connect with them because of the way they feel. And even if it's different, it's still a way that you can connect. Think about it think about meeting someone, anybody, a new colleague, potential mate, friend, whatever, it doesn't matter. And you meet them in any kind of social situation, you usually have an interaction with them. You'll ask them a question, they'll respond, they'll tell you something about themselves. And depending on their response, you might get your interest piqued or not. And then they ask you a question. But the way that you really connect with somebody is identifying with them by the way that they feel and, kind of what makes them unique, what makes them tick. So if I was to take Kartik's information and rephrase it, I think the opening question most people almost invariably ask, something like, what brings you here today? Tell me about yourself. Some kind of open-ended question like that. And I think a good way to start it would be a timeline.
Okay.
Because it's easy for people to follow a timeline. And so in Kartik's example, I say, well, I'm originally from the Stockton, Northern California area, and did my kind of, fundamental training or education there. And then I graduated with an undergraduate degree from CNU in X year. And now I'm currently a second year medical student at CNU, College of Medicine. And that kind of gives them kind of a framework or an outline. Now, the thing that I got from Kartik's response is how important it was to him that his community did not have adequate health care. So if I was coaching Kartik to respond to this in the future, I would tell him to expand on that part after he's given that framework.
Okay.
So he could talk about, the thing that drew me to medicine is my experiences shadowing when in the Stockton area. I noticed the lack of MD specialties and lack of access to healthcare for my, my fellow members in the community. And that kind of compelled me, urged me to go on to a career in medicine so that I could give back to the community. I also, during that time, I did volunteer, blah, 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 kind of give some support. And again, then you'll close with why. I feel this is my calling to give back to my community and provide healthcare. So that's the way I would structure it. He also discussed his love for Bhangra dancing, which I think is fine. To be honest, I'm really on the fence about whether or not in that kind of opening, tell me about yourself, if extracurricular activities, interests, and things belong. I don't think it necessarily matters. But most people, when they talk about kind of their background and things, they'll, if they are going to add kind of their interests, right? For me, it's cars, tennis, things of that nature. Most of the time, they will put that stuff at the end, and that's the last thing the person hears in response to that question. So if you do decide to include some of those things, you could put it up kind of after you've given the outline and then go into the important thing that you really want to exemplify. And for Kartik, that would be community service and helping increase the specialty physicians in the Stockton area. Also, if you're going to talk about your interest, it's okay to give a brief statement about why, what you get out of it, what and also if there's a way you can tie it into being a physician, that would also be excellent to do so. Okay, and one other thing that I want to talk about is many of the interviews you guys are going to be doing are going to be virtual. And I know I'm not giving a very good example of this right now, but I do want to emphasize the importance of eye contact, okay? Right now, and it's kind of hard on a virtual scenario, but if you can see my eyes, right now I'm speaking directly into the camera. Right now I'm speaking at Kartik's image, and now I'm looking at my image. And you can see my eyes change, right? There's me, Kartik, and the camera. So just remember, you're not speaking to the person's image, you're speaking to the camera, okay? And that might mean putting a post-it note by your camera, look here, dummy, or put an arrow or, something to remind you to talk to the camera. Because again, you're trying to make that personal connection with the interviewer. And that to do that, you need to connect with them, not only verbally as well as physically. And it's a little bit harder to do by Zoom. So eye contact becomes critically important. So just remember that.
Doctor, on that,
Yeah.
a quick question. When I'm listening to you, I look down to your picture because that's just a habit of, looking at the person who's talking.
Understood.
Is that fine?
Well, I do think that the one way to get around that is when you are speaking clearly, you want to look at the camera.
Yes.
When you're listening, I think most people understand that, at least in these Zooms and virtual things that everybody's become accustomed to as the norm, that, looking at various parts of the screen, if you will, changes. But one trick you can do is if you make the window for the Zoom where the images are, make it narrow and stack the images on top of each other, and then drag the interviewer's image as close to the camera as you can. Okay. So right now I'm looking at the camera, and let me take my glasses off in case it's clear. Right now I'm looking at the camera, and then if Kartik was speaking, I'd be looking at his picture, and you can see there's a slight difference in my eyes. But even though I'm looking at Kartik's image on my computer screen right now, he probably still gets the feeling that I'm engaging and looking at him. So put the interviewer's image as close to the camera as you can, and that means making the window narrow, and then you can drag the images around and move it around. Okay, back to virtual. I know this is I know this is an informal kind of prep session instructional thing, but Kartik's background is probably not ideal for a couple of reasons. One is there's a little bit too much going on in the background. If you can find a blank wall, or looks like there's a picture of a tiger or something to your back left. So a neutral painting, plant or something, so the background's just not a blank wall and sterile is fine. Okay. But try to have the least amount of busyness, if you will, in the background. I'm in my home office, and it's got, some of my car stuff, tennis stuff up in the cabinet, and mine's probably actually a little bit too busy also. But it's generally neutral, so it's not terrible. But if I was doing an interview, I probably would not do it out of my office. Okay. My house. The other thing is, if you notice when Kartik was speaking, he was making good eye contact. He was looking, I think, at me, not necessarily his camera, but I did feel like he was trying to make contact with me. But one thing that I notice with Kartik right now is he's looking down at his camera or image. Whereas if you look at my image, I'm looking more straight ahead, right? And I know he's looking down because his background is skewed like this. So if Kartik was to raise his laptop up so the camera is at his eye level, he would be looking straight as if he was talking to a person, and it comes across as more natural. So Kartik, raise your camera up to your eye level. Yeah, see, as he tilts the screen down, the background becomes more square, right? So sometimes that means putting some thick textbooks or something underneath your computer, so you raise up I'm kind of slouching in my office chair, but I'm sitting up now, and see how I'm looking down, right?
Yeah.
At the camera. But if I physically lift up my computer and now I'm looking straight ahead as if I'm looking at somebody, right? So keep in mind the optics of your background, as well as looking straight ahead as if you're talking to somebody.
Okay.
Okay, let's see. I don't have any other kind of general comments and things. Okay, Kartik, anything else we need to cover?
Do you want to do one more quick question?
Sure.
Okay.
All right, let's see. What other questions should we? Oh, okay. This is always a good one, and this is a good one for me to discuss all.
Okay.
If there's one thing you could change about yourself or an area of improvement, what would it be?
Sure. Yes. This question always is a very interesting one for me because it's something I like to change about myself and what I like to do during my free time because I like to think about where I can improve. And one area that I think I can really improve at would be overworking myself because I tend to keep myself busy with a lot of different things. It may be school, exercising, or maybe even keeping up with a show. I just like keeping myself busy at times. And I feel like keeping myself busy sometimes is a negative because it starts impacting my performance either at school or during my workouts because then I'm just thinking about the next thing and not really in the moment. And recently I've been trying to change that because there's so many things going on. I like to cut it down and maybe do less within the day, but have more focus on the things that I'm doing. So that gives me more energy and time to focus on the things at hand and go forward and complete the task at hand thoroughly and move on. Because if it's all busy and crowded, I feel like sometimes I don't put in my best effort. And I think putting in my best effort is more important than completing more tasks throughout the day.
Okay. All right. So Kartik hit on the big points about this question. So most people, again, go into an interview thinking they only have to say great things about themselves and impress the person and, overwhelm them to the point that if they say something that the interviewer is going to say, oh my God, we're hiring you right now on the spot. It doesn't work like that. The question about weaknesses is not really to learn what your weakness is. The question is twofold. One is, are you able to assess and are you self-aware of what your limitations are? Because that's an important quality for a physician. The second, and probably most important, is what have you done about it? Because they want to know that you're the kind of, you will be the kind of medical student, resident, whatever it might be, that accepts responsibility and accountability for their actions, strengths, weaknesses, and that you will fix any problem that arises. And that's the part about being proactive. What have you done about it? And Kartik hit all of those. He assessed that he works too much. He assessed that it decreases his efficiency. And then he says he's been working on it by doing less, but being more focused and putting his best effort forward. All excellent parts of the response. The only critique I would have is I think there were a couple of times you used the word less productive or not as good.
Yeah.
I think probably as a generalization to stay away from purely negative connotations or statements of that nature.
Okay.
And stay more on what you've noticed as could be being better and not necessarily saying the negative things, because the question would beg when he says, oh, I've been, I find that I'm less productive and I apologize, I don't remember exactly the phrase he used, but the question that popped into my mind is, well, tell me how you were unproductive, or tell me how you were inefficient or whatever. Because again, that's the kind of things that they're trying to pick up on. So you don't want to open the door, so to speak, for them to follow up with questions of that nature. So, it's fine to say, you stay busy, you work too much, but I find that it, I need to take time to regenerate, recover, and so that I can perform at my ultimate level, or put my best effort forward. Things I have done to accomplish this are X, Y, Z. And it comes across in a slightly more positive light. And again, they don't really care what the weakness is. I mean, of course, unless you say something outlandish, like you're a child molester, or you're a pathological liar, or something crazy like that. I mean, the things that most people say are going to be something in the middle of the road. It's fine. They don't necessarily care that much about it. They want to know: are you able to identify what your limits are and weaknesses? And if so, what have you done about it? Because are you going to be the medical student that says, you know what, I just cannot get acid-base physiology, and it doesn't matter, I'm not going to do that, right? Or are you going to say, I don't get this, renal professor, please help me understand this more? Are you going to be proactive about learning and improving? That's the most important part about the response.
Okay. All right, Dr. Ramsamooj. Thank you for taking the time today and for this mock interview. Hopefully I was decent enough, right?
Yeah, you were.
Okay. Good.
Just minor tweaks.
Well, hopefully everyone, that was helpful for everyone, and we'll look forward to doing something more later on. Thank you. Goodbye, everyone.
Thank you. Bye.
Hope this is helpful for you guys, and I hope that you guys can find this helpful in your future whenever you have your interviews, any medical school interviews you guys have. Dr. Ramsamooj has done a great job guiding me through this interview, and props to him and thanks to him. If you guys have any questions, please drop comments below, like the video and subscribe. We'll be posting more in the upcoming future. Thank you.